Hello, my name is Tony Nash. I'm the manager for the Nursing Education Department at UHS. The purpose of my message today is to let you know about a new program that we will be implementing in the summer of 2018. We are very excited to announce the inception of our new comprehensive professional nurse residency program. Why are we implementing a nurse residency program? Why is this going to be important to our newly licensed nurses and to UHS? The intent of the program is to improve the transition from college to real-world practice for our new nurses beginning their professional careers here at UHS. Evidence indicates that there are serious issues for new nurses making this difficult transition. Increased stress levels, increased reality shock are related to the increasing complexity of our healthcare environment today. We feel confident that this program will give us a competitive edge with recruitment, will increase our retention, and decrease our turnover. So let me tell you a little bit about the program and how it's shaping up. The nurse residency program will be a year long. During that year, the newly licensed RN will have support and resources provided for them through the program. The residency program will be open to nurses with 1 or less years of experience. They will have a residency advisor assigned to them who will provide them with support throughout that year-long transition, helping them work through the program. We'll be continuing our mentor program. We've had a mentor program for about 5 years now here at UHS hospitals, and that's been a very big success, and we'll continue that program. So each newly licensed RN will be assigned a mentor to help them with their transition. We'll also be continuing the Summer Clinical Resource Nurse Program. This program started in 2016, and it's designed to help provide the new graduates with extra clinical support at the bedside, in addition to their clinical coaches. We'll be hiring graduate nurses moving forward in 2 waves. So annually, graduate nurses will start with us in January, February, or March, and June, July, and August. That's designed so that after those hiring waves, they can be placed into the residency curriculum classes. So the residency is going to have 3 phases. The first phase is their classroom orientation that they'll have when they start initially at UHS with the Nursing Education Department. Then they will transition to the unit-based orientation that they'll have on their units with their clinical coaches. Then they'll attend the nurse residency curriculum classes. These curriculum classes will be held every month for 12 months. For the residency, when we have larger numbers of nurse residents, we will be splitting them into smaller cohorts to make the groups and the curriculum classes a little bit more manageable. It's important that these nurses stay and work through the whole program in their cohort. This is designed to provide them with additional support and that group cohesive concept that millennials and recent graduates really like. So we want to keep them in their cohort so they bond with their peers. The curriculum classes themselves will be a blended learning approach. It will be lecture and interactive critical thinking scenarios and simulations, and skill stations, all designed to help improve their transition. The curriculum classes are designed so that the first 6 months of curriculum classes will focus mostly on clinical concepts and clinical skill acquisition. The second 6 months of classes will focus on organizational concepts and professional development for the newly licensed RN. So let me give you an example of what the clinical classes are starting to shape up like. The first month is cardiovascular. Then we'll have respiratory, pain management, diabetes, behavioral health, end of life, safety from the patient perspective, patient safety, and staff safety, nursing excellence and quality, research, healthy work environment, communication and teamwork, professional responsibilities, risk management, charge nurse workshop, and clinical coaching workshop. And then the last day is designed for the resident to present their research topic poster and to have a small graduation celebration. The program will be thoroughly evaluated as we move through the curriculum classes. The content will be continually evaluated. The presenters will be continually evaluated. We want to assure that this is a high quality and successful program. There will be outcomes that will be measured. We'll be looking at several different outcomes to determine the success of the program. So what is your role in all of this? And you do have a large role, because that old saying of it takes a village to raise a child is absolutely applicable to the nurse residency program. We need everybody to help us foster and nurture these newly licensed nurses to make them a success. Understand that everything the GN needs to learn in our complex healthcare environment cannot possibly be taught in school anymore. It's going to take a lot of effort by all of us to help bring our knowledge to them and help them learn and grow. We want you to commit to helping them. Create a supportive environment on your unit for the nurse residents. Remember your own experiences when you started your professional practice, whether they were positive experiences or negative experiences, and build on those. Help foster this new generation. We're very excited to be developing this program, and we're confident that it will have a positive impact on nursing at UHS. You will be hearing more about further details in the coming weeks. We're going to be getting out there and rounding on the units to help introduce everybody to the program, but we're very excited to present this program for UHS, and we're very excited to have all of us be a part of it. Thank you.